I've been asked by Ergo to come down and talk as a customer today, which doesn't happen very often, so I may go on a bit. So I just want to start by telling you a little bit of where I've come from and a little bit about who I am. As I say, I'm a Software Solutions Manager. I've been working in the health service in Northern Ireland for 14 years. I started as a data entry clerk, so I have started on the very bottom rung of the ladder, and I've managed to work my way up this far, so far. So I have responsibility at the moment for community systems within the Western Trust, which is the likes of our mental health systems, our child health systems, our social services systems. Software development, we have a very small team of highly qualified software developers. When I say small, there's 2 of them at the minute. We're also looking for staff, we're looking for 1 more. I used to be a software developer, so I very much have a software developer's hat on me. And sometimes that means it's quite difficult to convince me that they don't need a bespoke development and something can be done very easily out of the box. So I always try and keep that in mind. And I'm a member of the ICT senior management team, so there's 4 of us, and we are responsible for making most of the management decisions within our ICT department. That's just a little bit about me. So I want to talk to you about the past for the Western Trust. We used to be called Westcare Business Services, and we were a shared service for 3 trusts up in Northern Ireland. Foyle Trust, Spare Maitland Trust, and Out the Galvin Trust. Out the Galvin being the acute hospital based up in Derry. And we provided services such as HR, finance, facilities management, which is our estates, health promotion, and ICT services, which I'm a member of. Now, if you can imagine, each one of those had their own domain, own Active Directory, own intranet, own policies and procedures, I should have put on the end, own ways of doing things. So we all had completely different ways of doing the same things. Then came the regional RPA, which was the Review of Public Administration, and the purpose of that was to redefine the structure of the health service in Northern Ireland and bring it down from 19 trusts to 6, including the ambulance service. So we have Belfast, South and East, Southern Trust, Northern Trust, and Western Trust, and the ambulance service, which, as you can imagine, was a major organisational change. And it sounds very glib to put it on one slide when it was such a huge change to everybody. So, I just wanted to give you a little picture of where we are up in Northern Ireland and what our geography is like. So we span 3 counties, Londonderry, Tyrone and Fermanagh. We have 5 council areas, 17% of the population. So lots of landmass. And as you can probably tell, communication is one of our biggest issues. We have terrible trouble communicating, even within our own department, because we have the IT department itself is, the main department is up in Derry, but we also have people in Omagh and people in Enniskillen. So even to manage staff and to communicate stuff is quite difficult. So, the present, which is where we are now. We are across 5 council areas still. We have 12,000 staff, and we have quite a large annual budget. So, part of our annual budget went on a 3-year regional enterprise agreement, which means that, from my perspective as Software Solutions Manager, before I think about anything else, I have to think, this is something that can be extracted out of our enterprise agreement. And in lots of cases it can, but we're not completely Microsoft House. So now we have 1 ICT department supporting the entire trust, 1 domain, 1 Active Directory, and 1 intranet. And we have 2,450 SharePoint users trust-wide. But I think that's only scratching the surface, as you'll find out later on. So what it did for us over the RPA period was, there was a lot of pressure on IT to deliver things very quickly. And we needed to share a lot of corporate information across the trust very quickly. And SharePoint was definitely the platform for us to do that. The organisational change, in a way, was managed in a lot of ways by us using SharePoint, mainly as document management to start off with. I have to admit, it was very much seen as a document management tool, but we're hoping to change that perspective. We all had to establish different ways of working, so teams coming together and trying to find one common ground that they would work on. And a good example of that, I've put ISD teams, because the integrated service delivery teams was about different service providers or different clinical staff coming together in a team to provide a service for one patient. So they were different geography, different teams, different ways of doing things, different legacy trusts that they belonged to, but they had to have one workspace where they could all collaborate. It was about collaboration. So we had to establish the need for common practices and common procedures. So collaboration was the order of the day back whenever RPA happened. So our first real foray into SharePoint, we did use it for document management at that time, and then we decided, probably a bit previous, to use it for the FOIL intranet. So this was back before RPA happened, when it was still the FOIL Trust. We had a champion in our IT team who wanted to take it on and try and produce the FOIL intranet on SharePoint. And at that time we were using Windows SharePoint services, which we still are. And it was not easy on the eye. Now, I did dig around in the archives and try and find some screenshots of that intranet, because you would laugh if you saw it today, honestly. They talk about corporate branding, their colours were purple and green, and the entire page was purple, and most of the writing was green, and it was horrendous now when I think about it. But at the time, we were wowed by the functionality. So, but I'm saying limited functionality, but at that time, we thought it was great, but it was limited, so we moved away from that. But we did learn lots of lessons, and we upgraded to Windows SharePoint Services version 3. So trust document management is what it has been mostly widely used for, and it's used extensively. We were very lucky because one of our directors, who at that time was not a director, started to champion SharePoint in a way, and she basically drove it from the top down, saying all of my planning and performance staff will use SharePoint for everything. So they put on all of their information, and we tried to pull it all up into one common spreadsheet that she could look at, and she could see where she was missing targets, where she was hitting targets, who was not putting their information on to start with was another good one. But she then got some champions in other directorates as well, and I think that's an important point, was that we had to look for those champions, and we had to kind of bring people along with us for the ride. And just a wee IT point was we promoted it as an alternative to shared drives, which was a big thing within our organisation. Shared drives were just, I can't even tell you the chaos of shared drives within our organisation. There were shares everywhere. And what we had to do was try and take that load off our ICT help desk and try and maintain administrators within each of the other directorates to get them to play their part as well, if you like. So that's just a small point. So some things that we use in SharePoint for today. So the first one I wanted to show was the labour ward, which is has been quite a success story actually within our trust. Basically how they use it is, this has been anonymised, so usually there are names of people having their caesareans, their emergencies, and other procedures as well within the theatre. So as you can see there, you can see the elective caesareans, and as I say, normally they would have the name underneath, so they know who's coming in, who's yet to come in, and they can actually report on those on that information. So I've just got a wee blurb from the consultant in the labour ward who said it was very easy to implement. But she does make the point that it's only as good as the users, which I think is another important point. And it's been so successful that she's had requests from other trusts to see how we did it, basically. So if you imagine that we're one trust up there, kind of plotting our own path, well, there are other trusts in a similar boat to us, and we have to try and standardise the way we do things across trusts as well. So that's one very important one. The family support team are using it for collaborative working across the trust sites, and they're seeing some big things in the way that they work, saying that it's made a vast improvement in the collation of information, because before this, everything was on shared drives. And so social work managers have access, service managers, heads of service, so it goes right from the bottom right up to the very top, and everyone's using it to organise themselves. And performance and service improvement, and this is the directorate where I was telling you about the director who championed it for us. So this is one of the most used sites on our current SharePoint. They have a lot of targets to meet, as you can imagine, in the in-house service. So instead of director asking their manager to go off and find the information and then come back in a couple of weeks' time. It doesn't happen like that. The director goes on herself, looks at the information, it's real time, it's accurate, it's up to date, it's all of the above. And they also have different sub-sites within their SharePoint site to look at other information. But we are aware of our limitations. I think it's very important to consider our limitations. We are running a very old version of SharePoint, which has no site search, and as we all know, that's a very important aspect of it. We need to update our hardware infrastructure. We have spent an awful lot of hundreds of thousands of pounds updating our hardware infrastructure across our trust in the last 3 years or so. And because of this, we need to bring SharePoint up to that level. We need resilience, we need it to be robust. If people are going to put their information on this thing, it needs to be working, and it needs to have failover and all of those kind of things. So we need to update the infrastructure. We need to make sure that when we need it, it's going to be available to us. So at the minute, I'm saying we have no cohesive SharePoint structure. Now my boss pulled me up on that point, but I still believe we don't have a cohesive SharePoint structure because it comes back to it being a tool that we thought we knew everything about. And we did get it up and running, and we thought that that was okay. So everything that's been added on since has been an add-on. It's never been a cohesive structure, and we would very much like it to mirror our organisation. We don't have a dedicated resource for SharePoint within our trust. As I say, we have 2 people in our software development department. One of them does spend some of his time on SharePoint. But SharePoint is much, much bigger than we ever anticipated it was going to be within our trust. So we have to accept that in those circumstances where we don't have the resource or the knowledge or the skills, we have to work very closely with other organisations like Ergo who are going to come in and help us to do all of these things. Organisation needs a robust solution. We do, as I say, it's got to be up and running when we need it. Backups and restores, that's been another one of my bugbears. There are occasions, we call it pilot error, where people, for whatever reason, lose a document. It's never been SharePoint's fault, I must add, it's usually the user's fault. But we need to know that if someone loses an important piece of information, that we can go right back down to the very document that they've lost and restore that for them. So it could be restoring sites, could be restoring for whatever reason, or documents, or whatever. But Mark actually sent me an email just last night about the granularity of restores within SharePoint, so I'll be reading that later. Thank you, Mark. And it says at the bottom, we have been a victim of our own success, and we very much have. As people get, word of mouth is a Bible thing, as word of mouth travels around our trust from the highest to the lowest level. People are asking us constantly. I actually put a stop on everything last year and said no more sites going on SharePoint until we have SharePoint 2010 up and running and it's all robust and everything. But we couldn't. We just couldn't do it because people needed to share information very, very quickly. And it's very difficult to say, I know it only takes 10 minutes for Damien to throw up a small SharePoint site, but I'm saying no because I want. So we've kept on, and now we have to migrate over all of our existing stuff onto it. So we need to scale up, basically. Future vision. Interesting. So obviously we're going to move to SharePoint Server 2010 with the help of Ergo. It's going to be robust, it's going to be secure, and it will mirror our organisational structure. And we see it having between 7,000 to 8,000 SharePoint users. So if you remember, we had 12,000 staff. Now not every nurse has their own PC or their own Active Directory account. So we have a lot of users who won't be using their own PC. But the ones who do, in our trust, as soon as you switch on your PC, you are presented with the intranet, which is my next point. So we need a new trust intranet for a number of reasons. Whenever we all came together, we threw up, literally, an intranet site, which is not searchable and not fit for purpose anymore, to be honest with you. So we are using SharePoint Server 2010 for our intranet.